like this. I've just drawn these tracks, some of these tracks on one side. This is the dorsal columns and the spinothalamic. These are ascending, they are in blue. This is the lateral corticospinal, anterior corticospinal. These are descending and in red. This is the right side of the body, this is the left side of the body. Now if I were to say that this side is damaged, so let's say this side was cut, so obviously the dorsal columns would be knocked off. So let's look at ascending, and you'll see that the spinothalamic tract would be knocked off. So where does this dorsal column get its information from? It gets its information from the same side of the body, so ipsilateral. So this is how the fibers are in. They come like this, they travel up. So if this area is cut, that means this ipsilateral side of the body is going to suffer. So you will say that the ipsilateral side of the lesion, that means on the same side as the lesion, you would have a lack of stereognosis and all of that. Let's look at this spinothalamic tract. This tract is carrying information from this side of the body. So the fibers actually come in, they synapse here, then they cross here, and they travel this way. So if you cut this, what is going to be affected? Obviously, information from this side of the body can go no further. So here, the effect will be seen on the contralateral side of the lesion. So you can see that. So for sensory tracts, what you need to know is, you need to know where the tract is originating from. So where the tract is originating from, in other words, where is it carrying information from? Now let's look at descending tracts, and I'm going to use a different color for descending tracts. So let's look at this corticospinal tract. This corticospinal tract, it began in the brain, and if this was the right side of the body, it began on the left side of the brain, and it came all the way down. It decussated in the, so we see that, it decussated in the medulla, and now it is traveling here. And what is it destined for? It is going to the anterior horn cells on this side, and then these will go to the body on the right side. So if you cut this tract here, what will happen? These fibers will no longer be able to synapse on the anterior horn cells. And which side is going to be affected? The right side, right? So you will see that it is an ipsilateral loss of function. So for descending tracts, in other words, you're always going to look at where is the tract terminating. And so hence that will be where the side which will be affected, and you base that on the lesion. So if the side being affected is on the same side as the lesion, you'll say ipsilateral. If the side being affected is on the different side of the lesion, you'll say contralateral. So two things to keep in mind. If it is a sensory tract, you want to see where it is originating from, and based on that, then you will compare it with the lesion, whether it's ipsilateral or contralateral. For descending tracts, you're going to see where it is terminating, and again, based on that, you're going to say whether it's ipsilateral or contralateral. So you can see that both are important, and that's why it's always better to draw and see that. For descending tracts, it doesn't matter where it started from, but see, now you have to see what is it going to affect. It's going to affect this side, and that's where